I'm Laura from Meow, and welcome to the first episode in our series Ask a Vet. I'm talking to Dr Martine from Perth Cat Hospital today, and we're going to discuss urinary health in cats. This is a topic that comes up often with my customers and members in our group, and it's one that seems to confuse us all. UTIs versus crystals versus FLUTD. What exactly do all these mean, and what's the difference between them? Hi Martine, and thank you for your time. Many people come to RAW after their cats have suffered urinary issues and they're looking for a solution using diet.
And for me, probably the first thing I do when I look at a case specifically is to classify as a cat under 10 or a cat over 10.
Okay.
Because the incidence of all the different problems that can occur completely shift as the cat becomes a senior cat.
Okay.
So typically a young cat has a very concentrated urine. Part of the reason why we're always promoting to try and avoid dry food and promote drinking water.
Yeah.
So the concentration of urine being very high is actually a really good defense against bacteria. So the likelihood of a cat under 10 years of age actually having a UTI is extremely low. Like you're talking like 1 to 5%, and I'll actually give you the proper statistics. Okay. So this is where people having a cat come in less than 10 years of age that is peeing blood and are sent home with antibiotics.
So it's not a UTI
is a big problem, not a UTI. So UTI stands for an infection.
Yeah.
So these younger cats...
we don't use antibiotics to treat infections.
Really should not be. And
that's what's happening with everyone.
Correct. And this is what really scares me, because there's a lot of things out in the literature at the moment with various resistant strains of bacteria as commensals in cats. Yeah. So if we then give a cat that doesn't need antibiotics, we could be pre-selecting for further resistance, and we run the risk of having a cat get an infection we can't treat, or just as bad in some people's minds, or maybe worse in some people's minds, a human that has a bacteria that we cannot treat. I mean, in our lifetime, we will be faced by the situation where a family member will get an infection that there is no antibiotic left for. So,
as a human race, we are over-medicated.
So antibiotic due diligence is critical, and the only time I would give an antibiotic is if you can get a culture. Okay. There are rare situations.
Can you explain what a culture is?
So a culture is where you take a urine sample directly from the cat's bladder with a needle.
Drawing it out.
Yep. So you're not having any risk of contamination of all the private parts at the back end of the cat contaminating. Or the litter, exactly. So it has to be taken directly from the bladder by a procedure called cystitis, and that basically involves the vet putting a needle directly into the bladder. It's generally a non-painful procedure. 90% of the cats I do it in don't require any sort of pain relief or sedation. Yep. And then we have a sample of urine that is representative of what's going on in the body. In the body, exactly. So we send that off to the lab, and the lab then put that urine on a little Petri dish, and they try and grow bacteria. And so obviously if they grow no bacteria, they'll see nothing on the dish. If they do grow bacteria, what they then actually do is two things with that information. So they will tell you what sort of bug it is, and they'll tell you how much bugs there are, and they'll do a sensitivity profile. So that gives us information where we can potentially, for example, rule out a contaminant. So if there's only a tiny amount of bacteria, then we would presume that that's not really representative of what's going on in the bladder. We ignore it. Certain particular types of bacteria that can be found in the bladder may be considered a normal commensal, and may not be one that could cause a UTI. So we may carefully ignore that. And then obviously finding out what antibiotic to use, which is the whole reason we're doing that.
How many different types of bacteria could there be that would be causing the problem?
I mean, there's numerous, countless, but the most common ones that we would see would be E. coli. So E. coli is normal in the bacteria in the bowel of the cat, so we think it's probably just a contaminant that's gone up for whatever reason. Okay. So coming back to the younger cats, already a cat's come into me, he's under 10 years of age, and I'm guessing there's a very low chance that this is a bacterial infection. It is good practice regardless to get a urine sample and send it off for a culture, but I would obviously prime the client that it's very unlikely that we are going to grow anything.
So it could be something that you might skip.
Could be in a price-sensitive client. It could be something. So your culture, you're looking at a couple of $100 for that.
Okay.
In a price-sensitive client, then potentially we could just look at treating for a non-bacterial urinary problem. And obviously, if the cat didn't respond, then go back to your diagnostics. But I would always recommend a urine sample, and in every case, just because you still have that 5% chance that they have an infection.
Always those people that just don't have the extra $200 to spend.
Yeah, exactly. But certainly not something I'd recommend.
No.
Ideally, for those clients that don't want to proceed with the more expensive test, I would still suggest to get a urine sample and have a look at it with an in-house test. That can still be a lot of information for me. Especially,
not all vets will do in-house testing though, right?
Okay. So what I would like to gain from that information in that cat, and you're looking at that being about a quarter of the price of a culture, the first thing I'd look at is what's the specific gravity of the urine. So if I've tested this cat that's a young cat with these symptoms of lower urinary tract disease, and I test the specific gravity of the urine and it's really concentrated, that I can feel very confident that no bacteria are going to be able to grow there. And so I can reassure that client and say, look, I feel very comfortable not culturing this.
Right. So the more, what we're saying is the more concentrated it is, the less likely there is that there's bacteria in there.
Okay.
Which then makes it possible, crystals?
Well, we'll come on to that. That's an interesting topic. So if we can think about the possible things other than a UTI that we could be seeing in a young cat, or in any cat really, but the percentage in a young cat is much higher than in an old cat. So we could just be looking at the most common scenario, which is feline idiopathic cystitis. And this is a really complex disease that I'm happy to go into details with you if you want me to.
Please do.
But that's going to be looking at, and don't quote me with these numbers because I will give you my little chart. I think it's probably going to be about 70% of cases. So it's more likely to have that than anything else.
But it is to be just a UTI, bacterial UTI.
Yep, exactly. And then the smaller remaining sort of collection of cases could be ones that have got stones or little urethral plugs with crystals, or they potentially could have something more unusual like an anatomical defect or a tumour, and that's getting down to...
It's got to be really rare, right?
Exactly, really unlikely. So we come back to this young cat that's come in and I'm suspecting it's FIC. I've done an in-house urine test. I've found that the concentration of the urine is very high.
So probably not bacterial.
I've had a look under the microscope and I can see some crystals, or I might be able to see some red blood cells or some white blood cells. To me, that is really strongly supportive that this cat has probably got FIC. However, if I am seeing crystals on that sample, then I couldn't rule out the fact that that cat could have bladder stone. And so again, sort of coming up to best practice in those sort of situations, if we found that the case was going to be recurrent or persistent, then imaging to have a look at the bladder would be very useful, and that would be an ultrasound and x-rays looking for a stone, because a stone is something that you can get rid of. Is
that surgically or?
Depends on what the stone is. There's this really cool tool that came out from the University of Minnesota. It's an app for us vets to use, which basically gets you to insert an algorithm of the age of the cat, the breed of the cat, and shows you different pictures of what the stone would look like on x-rays to help you try and determine the most likely stone that it would be. So different stones can appear in different levels of density on a radiograph, and that can help make you differentiate between the two most common, which is a calcium oxalate stone and a struvite stone. So a calcium oxalate stone will not dissolve with diet. A struvite stone potentially could dissolve with diet, and that would be your acidifying diets. So really trying to move away from having a highly alkaline. So with your potential FIC cases, they're really interesting cases, because this is where I do see them very mismanaged, especially where they're prescribed antibiotics, where these poor cats don't need them at all, and you could be doing damage. Old school vets seem to think that antibiotics are a safe option, and that giving antibiotics is better than not giving antibiotics, but it's quite the opposite. You really want to be very careful when and what antibiotic you prescribe, and think about what that antibiotic's killing, where it's actually going in the body. Is it actually going to do what you want it to do?
Or is it going to do more damage?
Exactly. So FIC is a really interesting disease because it's not one that can just be managed medically. The thoughts are with these FIC cats, it's quite interesting, and the condition occurs in people as well. And they think it is a mismatch of the stress response within the body. So our body's normal stress response, cats, people alike, we have two mechanisms that are activated within our body. And by stress, I don't mean, I'm about to rear end somebody with my car. I'm talking about every day-to-day, small little stressy things that are normal and functional.
That you probably wouldn't even notice for a cat.
Correct, exactly.
What stresses them is not
cat flap's not open and it's raining, or, whatever may be. I haven't got my food on time.
That's very difficult.
So basically what happens is you have your nervous system.
The heater's not on.
You have your nervous system, which produces your fight or flight response. So that's your noradrenaline and your adrenaline. And so that comes from, obviously your nerves. And then you've got your pituitary and your adrenal glands, so brain and just behind your kidneys, and they produce cortisol. Okay, and so what happens when you get stressed is your fight or flight response, adrenaline, and your cortisol, your adrenal glands, get activated together. And so you have this kind of mix of cortisol and adrenaline pumping through your system, regulating your ability to handle stress. Now, for some reason, and we don't know why, it could be early lack of sort of early exposure to certain situations as a kitten in that sort of sensitive learning period. There may be a genetic predisposition as well. It might just be luck of the draw, but there seems to be some cats where this fight or flight response and this pituitary adrenal axis seems to be mismatched. So what happens when these cats experience the normal day-to-day stress, instead of having these two triggered in concert together, they seem to have this excessive trigger of their fight or flight response with an equivalent blunting of their cortisol response. So what happens in these cats is they actually have widespread neurogenic inflammation from too much adrenaline. It's not just the bladder that's It is not just the bladder. It's very interesting. And
where else would this inflammation
Huffington,
go?
who is a world leader veterinarian in studying FIC, has termed it Pandora's syndrome because it's a bit of a mystery box. And so organ systems that can be affected in these cats, and I find if you actually start questioning the history of these patients, you'll find that they're actually getting these subtle symptoms. But it could be skin, it could be heart, it could be bowel.
It could cause rashes.
It could cause, so skin rashes, thickening of the heart, tummy troubles, sensitive tummy, those sorts of issues. And so they think that the bladder itself is highly sensitive to adrenaline. And so this becomes, in most individuals, people as well, the target organ. So it's the most sensitive organ. So this bladder becomes really inflamed, not because there's any bacteria in it. And then you add to that, you've got this really concentrated urine of the cat, which is normal. And you can imagine that burns and irritates that bladder furthermore, so that perpetuates more inflammation. So the key in these cases is not just a tablet, and it's so important to remember. The first point is to dilute the urine, because by diluting the urine, you're relieving some of that burning irritation that you're creating on an inflamed bladder. It's not going to neurogenic inflammation through the body, but you're going to give immediate relief to the symptoms. So that's really important. But that has to be gradually, because any change in a cat's environment has to be gradual. It has to be with implementation of, to the nth level, environmental and emotional enrichment. And so that's where your mates, the 5 pillars, come in, obviously.
I knew those were coming up.
They come into everything. So that's where, realistically...
So explain the 5 pillars.
Okay, all right. Woo! I couldn't not put it in there.
I know you love that.
So basically, cats are not little people. That's really important to remember, as much as we cradle them like babies. And look, I have no human children. I have 2 cats, and they're absolute loves of my life. They're cats, and they have very, very different needs to what we have. And that's really important to remember and very easy to forget. And so some years ago, a collection of cat vets with a very special interest in behaviour really started to recognise that majority of people around the world that own cats don't seem to understand what the basic needs a cat has in their environment. And there was a really interesting paper recently by Gabrielle Lawson, who works at the cat clinic in Hobart. And she actually, with Andrea Harvey, did this survey of like thousands of Australian cat owners, thousands, inquiring about certain things within their environment and with their care to get an idea on how many Australians are actually fulfilling, not just going best practices, crazy, cat towers and fulfilling the basic needs. Yeah. How many Australians are fulfilling the basic needs?
And how many were there?
Barely any. Like, I'll get the paper for you.
So what are these basic needs?
So this is where the 5 pillars come in. So the first thing, coming back to that fight or flight response, which is triggered in most cats and obviously really highly tuned in the FIC. So cats are these creatures that are just solitary hunters. So as much as they form these beautiful bonds with us and with other cats, they have this hardwired need to make sure that they are responsible for their own safety. And that's because they hunt for food on their own. They don't hunt in teams like dogs. So at every point in time of their day, they need to feel like they have a place that they can go to retreat, to feel safe.
Yeah.
And it can't just be one spot in one corner of the house. Like, it needs to be multifaceted. Wherever they are, they need to feel like there's somewhere they can go where they can become invisible. And so mistakes that we do, I mean, obviously we provide them with cat trees and boxes and tunnels and all the things you can see throughout the whole house.
Like mine.
You know, problem is that people will often not respect that. And so when a cat takes themselves to their safe place, which you may or may not be providing enough of in your household for your cat, we then have to pretend they're invisible. Like, you can't actually then pluck your cat from the top of its cat tree because it's gone to that safe place for a specific reason. So your ideal safe places need to, really be something that only one cat fits into, unless they're a berm, and then maybe two. So, one cat fits into, up off ground level. Yeah. Ideally if it's up off ground level, even with a little kind of like edge so that they can hide. Right. So,
or a blanket they can get under.
Blanket, exactly. So awesome options are obviously your cat trees, your cat shelving that many people put around their home, ground dwellers, especially your arthritic.
Oliver loves his basket in his cat tree king.
So cute.
And you have to go and feel if his bottom is in there. You can't see him.
Yeah, because he sinks down. Yeah. As cats get older, their ability to climb's decrease. So senior cats can be happier with, igloos and tunnels and things on ground level, so they don't have to get up, because if you've provided that for them their whole life and then they age and they can't get to them, then that's very stressful.
It's even more stressful,
Yeah. So little kids cannot extract cats out of safe places. Dogs shouldn't be able to shove their noses into safe places. If you've got multiple cats, try and make sure you've got, at least multiple. The rule of thumb for any resource is at least one for every cat plus extra. Yeah. That's really important, and not to have them all lined up in a row as well.
I'm so happy I've got that. Okay.
Yeah, because
I've got the first pillar.
I see this in my behaviour consults. People have Googled online and they've got 3 cats and one's toileting inappropriately, and they're like, but I've got 4 litter trays, and then they show me these 4 litter trays in a row in their laundry. I'm like, okay, and to get to the laundry, you've got to go all the way down a hallway. So it's like right at the end where another cat can block the hall. Exactly. There's no easy way in and out. So safe places is really important, and it's really easy to say, oh yeah, I do all of that. But in these FIC cats, you've got to do more. You've actually got to critically look at what you've got and not be stubborn and realise you actually have to do even more because your cat has really special needs. Yeah. So your second one kind of leads on to that, and that's your multiple key separated resources. So to put that in English, it's basically saying every cat needs their own stuff. and they need lots of their own stuff. So not feeding from one fixed location in the corner of the kitchen.
Or on one plate, they drive me bonkers.
Exactly. So you can't be doing
Mine
that.
all
Cats,
eat in separate
they're solitary
areas.
hunters. They don't like it. Like cats will eat together.
Yeah, but they're not enjoying it.
But they're not enjoying it. And, you know, I get with my behaviour consults, I get clients to send photos of their cats eating. And you look at their body language, you're like, see, look, they eat together. And you look at their body posture. So a cat should like sit right down when they're eating, right? And be focused on their food. And you look at these photos of these cats and their ears are rotated. They're giving each other side eye. They're standing, not sitting to eat their food. Who wants to eat standing up? I mean, that's a vet thing. Like most normal people shouldn't be doing that.
That's what they think too. When you wake up raw meow.
Yeah. So, you know, so multiple key resources basically implies everything. So you need to have loads of sleeping areas, all separated away from each other. Loads of litter trays, all separated away from each other. Loads of food eating opportunities that aren't in the same location. Loads of ability to drink, again, not next to the food because they're hunters and they don't like to spoil their food. And so this is a big one. And again, in my behaviour consults, especially for an FIC case, I'll get them to draw a floor plan and mark everywhere on there. Like, where are you putting stuff? And people don't realise. They're just, you know, people don't think, but I've got 4 water bowls. But, you know, they're all near in the feeding area, you know? So that's really important. And again, an FIC cat, whatever you're doing, even if you're doing the basics of what you should be, 1 for every cat plus 1, it's not enough for that cat.
You need to double it.
You need to double it and you need to think about locations. You know, what I did with the boys when they started drinking a lot more and needing to drink a lot more with their kidneys, is I actually started experimenting putting water bowls in different parts of the house and found that, you know, there was some that they loved and some they didn't touch. So, okay, well, if they didn't touch that one, let's try somewhere else. And so you just sort of cycle through locations to try and find out what works. It's not hard. So pillar number 3 is talking about another basic need of the cat, which is the fact that we domesticated them about 9,500 years ago to hunt mice. But did we? Yeah, to hunt mice. That's all we did. So the dog we've domesticated for all these purposes, and we've purposed these dogs to do these things for us. They are our slaves, whereas we are the cat's slave, really. So we domesticated them just to go hunt mice. That's all we wanted them to do. We've never expected anything else of them until maybe the last 50 years. And then we've said, no. You're not to go outside and hunt. That's actually bad, even though I've asked you to do that for the last 9,000 years. I don't want you to do that anymore. I want you to stay inside and not hunt. So this can really create some quite profound problems in cats, including FIC, obesity, you know, all sorts of things where...
Turns Oliver into a homicidal maniac.
If they can't...
If he doesn't hunt every day, he comes for me, he hunts me. The other day he sat next to me and he did this meow that lasted like 45 seconds. One whole long meow. And I just went,
oh my God.
All righty then, let's go play.
He's just got he's really good at projecting his voice, isn't he?
Because I thought, I don't want to play today. And I went, oh, I have to.
Yeah. So definitely,
every day.
You know, like consistent play. So and not just the same.
And this is something that, you know what, is really new to me. Only since I got the Burms, because I never played with any of their cats.
Yeah.
They were just there. And so many people's cats are just there.
Yeah. And it doesn't take hard to work out how to get some of those cats to play it. Probably the hardest ones I find are your British and your ragdolls. Like the British shorthairs and the ragdolls are notoriously quite lazy, although some ragdolls are not bred properly and are not lazy and quite neurotic. But, you know, your classic ragdoll and your British, they really are looking for shortcuts in life as much as possible. They just want to hang out. They're just very relaxed. So, you know, it's about trying to find what drives them and not just...
So they might not need to be running. You might just need to flick something in their face and let them do that.
Correct. Exactly, but they've got to catch it. They've got to feel like they've caught the prey.
Oh, that's what I do with Oliver. And he catch like multiple times. He'll catch it, and I let him take it away, and it's just like, and he takes the whole stick and everything into the bathroom to kill it.
He used to be like that, and then he'd be like, ooh.
And he's so proud of killing it.
Yeah, it's so gorgeous.
And then we have to do it again.
So putting it away when you're not playing. So interactive play is the best. So playing to fatigue, ideally.
Catching,
playing daily.
Killing.
Exactly. Put it away.
Before you feed them too, right?
Yeah, that's the best time to play. Yes. Absolutely. So then they've got that drive.
Oh, they eat so well after they play.
Yeah, and then they get that reward of like, the
eating
flesh of
what
a
they've
dead
killed.
animal.
Yeah, exactly.
Oh, so good. Put the toys away, especially the birds, especially with burns, because of the hazard of them ingesting it. Other things to do, puzzle feeders are another really great way to
not tried that,
fulfill the hunting instinct.
Even hiding treats around the house before you go to work or something.
See, and the more diverse you are, then the more way you're fulfilling that need of your cats. I mean, definitely with my boys, the poor loves, like I have to get like 4 yoga mats out before I can even begin to bring out a toy because they're so terrified that they're going to slip and fall.
Really?
So we use a lot of puzzle feeders in their old age, which they're really quite happy with, fishing bits of freeze dried out of. You can see the little white one down there. They fish it out, and then the mice they knock about. And just trying to, obviously change what we do on a daily basis. So they've still got things.
leaving toys out. We've got like balls all over the place.
Yeah. So little toys. So sticks I always suggest to put away.
Yeah.
Little mice, leave them out.
Yeah.
And refresh them. Like the alternate form of cat crack. Those rabbit fur mice. That's another form of cat crack.
It is.
And recycling them. So that's really important. And look, I really don't advocate people letting their cats having free access outdoors and hunting in a natural way.
I believe being outside is good too.
But having them have an opportunity to have a freedom of choice to go outside is really important for their welfare. We didn't put our cat running in until these boys were 10 years of age, and I regret they're missing out on that for the first 10 years of their life. I mean, for us, it was a finance thing, and as soon as we had the money, we did it. But they, even now as old cats, both nearly 17, and they still go out, they sit in the sunshine, they look at the birds. They really gain a lot of enjoyment.
I think so.
And just having that freedom to access outside rather than having a harness put on them and it being restrictive in a way a person wants to do that, which is very unnatural for a cat. So, so that's obviously number 3. Number 4 talks about how you interact with your cat, because we can actually,
that's a big one, I think.
Yeah, we can actually, unfortunately, inadvertently have some very negative implications on how our cats feel and how their emotions are. So the big one is discipline. So you and I come from the era where whenever we were naughty, we got smacked on the bum. But we know in this day and age that is not the right thing. And some people might not agree with me, but I don't think that's the right thing to do for a child. And I can tell you now, it's definitely not the right thing to do for a cat. So all you're going to achieve if you use any sort of negative or positive punishment in your cat is that you're going to make the cat more fearful of you. You're potentially going to trigger other forms of behavioural problems. You could potentially trigger aggression.
Squirt bun?
Squirting does the same. You've got to be really careful with the squirt thing, because a lot of bad behaviours in cats come from underlying anxiety. So obviously the squirty, I don't tend to recommend it, but if used, it would be something that would have to be triggered when a human wasn't around and in a cat that doesn't have underlying anxiety. So, and it is a form of negative punishment. So you're doing something bad to your cat to make them do something good, which we know is a very poor form of...
doesn't work for anybody.
Very poor form of training.
Yeah.
So all training really should be positive reinforcement. They do something good, they get something good.
Yeah.
And that can be used to shape behaviours in cats to what you want them to do. So perfect example, which you've seen the scratching post on the end of my kitchen bench. Years and years ago, Rolly just insisted on having to be on the bench when I was preparing food. Now, I don't particularly care if my cat's on the bench, but I have some guests that are quite horrified. So I thought...
I just don't invite anybody over.
So I've found a very easy way to get around that. I put a scratching post that's the same height as the kitchen bench on the end of the kitchen bench, and then I clicker trained him and reward him for going on the scratching post. So now, as soon as I prepare anything on the bench, he hops on the scratching post and he waits. Sometimes, if it's some particular raw Meow products, he may not stay there the whole time.
Not my fault.
But most of the time, he is very good and he knows what he's meant to do. So that then kind of leads me to, obviously, no negative reinforcement, no negative punishment. What you can actually do, which is a big part of my behaviour consults now, especially in young cats, is to actually start to train your cats. So cats, especially those that are food driven, are actually quite easy to train. And an example recently that I did with Eddie, he can no longer jump up on the bed. So I bought some stairs from Kmart, $20, awesome. Wouldn't use them. Wouldn't just not use them, but wouldn't even go near them.
Scary stairs.
Scary. So we used, with the help of clicker training, so getting him to nose touch a target, get a click, get a reward, managed to get him to, he now uses the stairs every night to come up onto the bed, which is really awesome.
And you get him to do that for his...
And for his stretching, for his like movements as well. So this is really good, especially if you've got kids in the household, because kids seem to really embrace training animals and training them how to do tricks.
I used to love it.
And it's so much fun, and it's really good for them to bond, because as the parents, you're probably doing all the feeding and all the other care. So it's a way of getting the kids to obviously join in on caring for the cat, and that can be really proud.
Stimulation for the cat.
Yeah, exactly, and it's bonding for the child as well.
I wish I'd done it with Meow.
So things like, training, we've got loads of cats that come in and can high five and do all those sorts of things, which is really awesome. My direction, if you wanted to put a link, there is a website, Karen Pryor, who's like the grandmother of clicker training, actually does produce a clicker training for cats book, which is really cool. I think it's about $15-16 online, and you can buy one of her clickers, or even a clicker with a target, which is what I've got, and that can be amazing at really trying to enhance all that sort of bonding. But other things that you can use positive reinforcement for are things that are not great for the cat. So, if you want to train your cat to learn how to have their nails trimmed, using food as a food reward, distracting them and trimming their nails. And for those of you that follow us on Facebook, you might have seen, some of us giving a vaccination or other forms of treatment to a cat whilst distracting them with training treats. So that's really important. And what actually happens with these cats...
What treats do you use when you distract them?
We use two treats. One is freeze-dried, Meow. Not every kitty likes that. So the other is those disgusting little creamy treats, which just some cats are just like...
Oh no, but they're just gross. It's like toothpaste.
It is like toothpaste, but it keeps their attention.
Yeah.
So that's probably my two preferences. I do quite like, obviously with the creamy treats, it's just a single lap and then back to attention. So if you are going to use the freeze-dried, it's really, really important to break off a teeny bit.
Otherwise they get distracted eating it.
Exactly. Otherwise it's not going to be reinforcing it. So you've just got to make sure a little tiny mouthful, done. Okay, focus, let's continue with our
Ours get a treat after we do their nails. Although they're really good at doing the nails, we still want to make it a positive.
Yeah, exactly.
So they sit with me, get their nails done, Daddy takes them and gives them a treat.
Yeah, and that's the way to do it. Positive reinforcement is key, and it's just going to bring, your cats are going to be so more receptive to wondering what you're doing and want to be engaged with what you want to do with them. It just makes your life so much easier. And we've got, just takes a lot of time going through the 5 pillars, doesn't it? And then number 5, again, is another one that's overlooked, and that's respecting the fact that a cat has the most incredible sense of smell. So their sense of smell, double check this fact, but I think it's about 40 to 50 times more powerful than ours. So nowhere near as keen as a dog, but definitely a whole entire different world to us. But what also becomes really important with the cat, which is more developed than in the dog, is their vomeronasal organ, which is this little kind of bony chamber in the front of their nose that directly connects with their brain. And that's a part of their nose that's responsible for smelling pheromones. Okay? So pheromones, for those who are not aware, are chemical messengers. So they're basically things contained in various different body fluids of the cat that contain a very specific message, either to back to the cat itself or potentially to other cats. So those messages could be in urine, they could be in cheek secretions when they head bump stuff, they can be in feces, anal gland material, they can come from the foot pads, they can come from around the mammary glands, not in the milk, but around the mammary glands themselves. And they can, really convey...
do that and everything?
So there's about 5 different pheromones that they mark when they do that at various different points in time, communicating various different things, which is so
why
interesting.
Are the cats marking everything in the house?
So when they're marking like objects, they're actually marking it with the type of pheromone that's in the Fellaway that's available in Australia, or called Fellaway Classic in the rest of the world. So that's the one in the purple bottle. So that particular facial pheromone cats will use to mark inanimate objects within their core territory. So what?
Just to let others know that whole space is theirs?
No, it's not a territorial pheromone. It's a pheromone that basically then communicates back to that individual to say, this is my safe place. Okay, so there are there are other facial pheromones that they also do emit at various other times. So there's a different pheromone that they will use when they rub on us. So that is more, you are my friend, whereas the cupboard's going to be, this is my safe place. Okay. So there used to be a spray form of the You Are My Friend called Fellaway Friends or Felly Friends, but it's not available in the world anymore. They stopped making it for some reason. So there's another one that comes from around the mammary glands, which is what you were sort of leading on to. And that is one you can get into the country. It's not illegal in Australia. It just doesn't have a license for sale in Australia.
Fellaway Friends?
It's the Fellaway Friends.
Where's that come from?
Or Fellaway Multicat in America. Fellaway Friends is from the UK. So that comes from the mammary glands, and basically that is a pheromone that the mother cat produces when she's lactating. Yeah. And it says to the litter mates, you guys be besties. You all get along, you all be friends. So that actually I'm finding in practice is a much more powerful pheromone to use.
Why we can't get a human?
I have been pestering Siva for over 2 years now. They have them in their scratch pads. So you might have heard of Felly Scratch. So that's a pheromone that it gets secreted by the interdigital glands, and that actually says, this is my territory. Okay. So that's an ownership type of pheromone. And then there's a whole bunch of pheromones that can come out in the urine that can say a whole bunch of different things depending on what they're trying to say. So, they may mark the urine to say, this is my territory and I'll be back at 6 p.m. Or they
like emails.
Yeah, exactly.
Messenger.
It's quite incredible. That's cool. They may mark their territory and say you're not welcome. Because some cats timeshare. I don't know if you've seen that amazing documentary of Sarah Ellis, and she found that some non-social cats will timeshare the same property, and they do that through pheromones. So they'll spray and say, I'm here till 6 p.m. and the next one will spray and say, I'm out here till, midnight or whatever. It's just, it blows your mind.
That's weird.
So that's something that, we need to remember that there's all these messages all around our house that we can't smell and are oblivious to. Yeah. So cats can't smell dog pheromones, cat can't smell rat pheromones, so it is species specific. Okay. But those messages can be very harsh. So, the next door neighbour's cat that came and sprayed in the back of your garden, but your cat's an indoor cat, they can smell that. Yeah. They can smell that somebody's been in their territory saying, this is my territory. That would be very confronting, and that can cause great stress that you're completely oblivious to with your cats indoors. So can I ask you a question?
Many times that's happened that a strange cat in the area has caused the 2 resident cats to fight with each other.
Yep.
Why is that?
Yeah. So, there's a few things, I guess, that could cause that. Probably the most likely would be what we call redirected aggression. Yeah. So that comes from an emotion of frustration. Okay. So frustration is
basically I want to beat up the next door neighbour's cat.
I can't get to
them.
I can smell them. You're also looking unhappy. I'm feeling bad body language. Let's attack. So Rolly used to get a lot of redirected aggression. The dog next door, they've now moved out, used to really stir him up, and he would sometimes come in and attack the crap out of Eddie. Oh. So, and that's not Eddie's fault. It's because and it's not the dog's fault. It's a horrible situation. Norm sometimes comes in from the Amazon, and he might who knows? Doesn't come
He went out yesterday, I don't know.
And we suspect he must go through some garden which might have some cat urine. Oh. And Rolly will be like, phew, dilated pupils, bam, go to attack the shoes. So he knows the shoes are not a cat.
Some cats more prone to that, like more worried about that, or they just...
If they've already got some underlying anxiety disorders, then they're probably more likely to go to redirected aggression. So definitely with him, we know he's got, various different anxiety disorders, which thankfully are well controlled with medication.
So that's the fifth pillar?
That's the fifth pillar.
Okay.
So as you can see, there's absolutely no way that you could explain to a client how to treat an FIC cat in a 15-minute consultation.
No.
It's just not possible. Because they've actually got to think...
So there's no medication you would give someone like that?
There is. So in an outbreak, like in a episode of FIC...
My young cat, under 10 years old, comes in, pee in the blood.
Yep. We've done
struggling
a urine,
to pee.
Really painful.
We've done a culture, bet $200, there's no bacteria.
And his bladder's not obstructed, because that's another whole kettle of fish, which can happen with FICs. All that debris can block the little penis. So he's not obstructed.
That doesn't really happen to a girl cat, or
doesn't happen to a girl
at all.
It's always a boy, because they're...
which is why it's very important to get to a vet.
It's really important especially with a boy, if your cat's straining to urinate, that even if we know he has FIC...
obstruction is still not crystals?
Obstruction. Now that's an interesting one. So most cases of obstruction do tend to have underlying FIC. Okay. So that's the starting problem. But
let's just say FIC caused by stress.
Stress.
Just to put it in really layman's terms.
Yep. So we'll say stress.
And 70% of cats under 10 years old will have that.
FIC. Now some of those will go on to develop obstructive FIC. So FIC can be obstructive or non-obstructive. So the obstructive cases tend to be ones where all that debris within the bladder, it may be crystals, it may not. Crystals, schmistals, to be honest, normal cats can have crystals. So I don't want to over-interpret crystals. Too many people over-interpret crystals. Crystals can form in urine from it just sitting in the jar and then going in the fridge,
Crystals comes up a lot.
Crystals are only a problem if the cat's obstructed. Okay. Because what happens is that you get all this mucoid debris within the bladder as a consequence of it being very concentrated. The bladder wall's really abnormal. You're getting protein and red blood cells and white blood cells and a whole lot of crud. And that unfortunately has to pass through a very curvy passage in the boy that is about a millimetre or so in diameter at the tiniest point. So you can imagine if you're trying to spit out all this sludge through a tiny little opening, there's a chance it can block. And it usually blocks just in the end of the penis. And if that happens, that can be very dangerous, because if they can't urinate, right? Correct, exactly. It can also, unfortunately, be one of the most frustrating things in feline medicine to treat, because there's no quick fix for FIC, as I just described.
Yeah, but there's a quick fix for the blockage, right?
Yeah, but they can reblock. So some cats can reblock multiple times in 1 week, and at several grand a pop, it can be a really...
Which is why cats then get put down.
Or they have surgery to remove the tip of the penis off. Yeah.
That's a little extreme.
It's very extreme. And it doesn't address the problem. You're just addressing the risk. But you still have this cat with FIC that's got a problem in its bladder, that's a problem with its nervous system. Yeah, so so they're really tricky cases, and I guess, that's the first thing, if you've got a cat coming into me that's peeing blood, firstly, is it a boy, is it a girl? And the nurses know already to look at that very quickly. Is it a boy, is it a girl? Because it's a boy, then you need to come in immediately in case he's obstructed. We then palpate the bladder. Is the bladder full or is the bladder empty? Okay, well, if the bladder's near empty, then he's not obstructed. Okay, well, let's move on to the next step. So let's take a urine sample. Let's determine whether it's concentrated or culture it, and then we go from there. So for those uncomplicated, unobstructed FIC cats, the first thing they need is pain relief. So they're a highly stressed cat that has a really excruciating bladder problem. Exactly. So for those cases, we'll always say, quit the biscuits ASAP, provided that's not going to be a source of stress. If it is going to be a source of stress, taking the bickies away, unfortunately, you're going to have to do it slowly and gradually.
Yeah.
So pain relief is really, really important.
Yeah.
Obviously, if the cat is not that well and hasn't been eating or drinking, it can't have a non-steroidal. So even if they've got some meloxicam at home, don't give that until you see the vet. To be honest, most of them I will send home with buprenorphine. I'll send them home with Temgesic. So you want something that's a good painkiller that's immediately going to give these babies some relief. Yes, they're going to be weird, but you know that it's safe on the kidneys, and you know that they're going to be comfortable. Increasing water intake is critical. Trying to minimize time in hospital, and that can be really
stressful.
Exactly, and that can be really tricky if you can't get a urine sample straight away, unfortunately, because we need that urine sample to know what pathway of treatment we're going to recommend. So pain relief is really important. For some of them, especially those that have obstructed before, there's some other a little bit more quirky drugs that we might reach for, like antispasmolytics. So putting a catheter up the penis can really make the urethra very miserable. So we will often send them home with muscle relaxants to try and keep that urethra calm. Quite commonly. Antibiotics obviously only when indicated, which is very uncommon, and diet, increasing water intake. So sloppy,
so if they're plugged up
stuff.
though, blocked up?
So if they're blocked
how
up...
do you unblock them?
Yeah, that can be really tricky.
Because obviously it's life or death at that point.
Correct. So the first thing we do when they come in is we look at giving them some pain relief and some anti-anxiety medications straight away. We look at, generally for most of them, we will do a decompressive cystocentesis. So that is a bit of a slightly more complicated version of just getting a urine sample for culture. So we'll actually put a little special tube in with a needle with a little giving set to repeatedly drain off the bladder. So we're immediately saying to the kidneys, you're okay, you're not under duress. Once we've done that, then we will need to look at placing a catheter. So we then will...
So you'll try and remove the blockage with that?
Correct, exactly. So obviously no cat is going to allow you to do that conscious.
No.
We have mixed success with doing it under an epidural, which is obviously much safer. So once we've done the decompressive cystocentesis, we'll get some bloods, get the catheter in, get them on fluids, and then place an epidural. And I do find that, potentially up to 50%, especially if the cat is not panicking and is really placid, we may be able to place a catheter with the epidural and just some sedation on board, which is obviously far better for the kidneys. But unfortunately it's not always successful. So we don't always count on that. But especially for the really moribund ones that are, their potassium is through the roof and their heart's like arrhythmic and they're really sick, then we want to try and see what we can do without a GA. So the actual catheter placement is technically quite challenging because potentially, you can really traumatize that urethra and permanently damage that such that it's all over Red Rover. And that doesn't fortunately happen very often if you're very gentle, but there is that possibility. A lot of the time it is this mucoid plug that I talk about, or crystals. And
that will come out with the catheter.
You slowly core it out and you flush and you core and you flush and you core and you flush. Get the catheter in, we then flush the bladder to make sure we get all of that crud out. And then once we've flushed the bladder, we will then take an X-ray to make sure there's not a stone. That's really important. Then we'll recover the cat. The cat generally stays with the catheter in place anything from 24 to 48 hours, depending on budget and depending on how bad it was. So that's obviously something where they need to be at emergency for the night because they've got a catheter that if that kinks, then it just serves as an obstruction. They do go, once you relieve that obstruction, they do, unfortunately, their kidneys kind of go through a bit of a surge in urine production. So they get this, what we call post-obstructive diuresis, where they just control how much urine they're losing. So these guys need to be on a lot of fluids, and then you've got to very, very carefully tailor them down as the kidneys.
Do you send them home like that, or?
No, it's IV fluids. So generally looking at about 3 days in hospital, intensive care between us and emergency.
What's that going to cost you for blockage? Finding a blockage to take it away?
Yeah. So I mean, usually can set anything between sort of $2,000 to $4,000. There are some cats, not all. When you pull the cath, within 12 hours they reblock. So, and that could be because there's still more sludge. That could be because the urethra is spasmed. Look, obviously it's always up to the owner and where they're at. Ideally, you've replaced the catheter, you leave it in for a bit longer. I tend to suggest if that happens third time round, then we don't put a catheter in and we get them to a PU surgery. We get the penis taken off. You can't just keep catheterising, it's just too traumatic. You obviously run the risk that that catheter goes elsewhere and then the surgery itself might not be successful. They're terrible cases. They're often very sick kitties.
Does this happen a lot?
Yeah, look, I mean, it is quite a common condition. Interestingly, I see it less commonly at the cat hospital than I thought, than I maybe would have in general practice.
If they're not just going somewhere else, or if...
I actually think cat hospital clients are slightly better educated in the 5 pillars. Even if they don't necessarily know them as the 5 pillars. I think a lot of them, they know, they're educated from us from the word go not to feed a dry, exclusive diet.
Yeah.
The multi-cat households have already had it drummed into them about, providing appropriate enrichment. We plug puzzle feeders left, right and centre. Again, we encourage raw feeding. So I actually think as a percentage, and this is not based on any actual proper data, but I'm surprised that I don't see more blocked cats, considering I see 100% cat now.
Yeah.
I actually think the number of cases is similar to when I was at Midland, but I would have only seen, 50, 40% cats. So I find that really interesting, yeah. And so I think, as education becomes more available to people on behaviour and people learn that behavioural medicine is not exclusive to veterinary medicine. So it's all which is why what you're doing now is awesome. It's all working from the ground up and educating. So
well, I mean, that's what I've always been about.
Yeah. So and that's amazing.
The more I learn too, the more I can pass on.
Yeah. So definitely passing blood is an emergency. Let the vet decide where to go from there. I mean, obviously
antibiotics are not always the answer.
No. So the older cat, whole different kettle of fish.
Okay.
So a cat over 10 years of age is more likely to have a UTI than anything else.
Okay.
They do also have a high risk of cancer as well, obviously.
So trouble peeing, blood in the urine could be cancer.
Could potentially be cancer.
Okay.
Yeah.
Not ever heard that before.
We've had a handful since we've opened, unfortunately. UTI, old cat, right?
Yes.
Obviously bladder tumour, much less common than an infection.
Okay.
So infections don't tend to just happen in an older cat.
Okay.
You have to look for an underlying cause. So, which is why even if a cat comes to me that's over 10 years of age and presents with blood in its urine, you still need to culture it because you need to know what antibiotic to use. You need to know what bug it is.
So it's not just one antibiotic for UTI?
No, not just one antibiotic, not at all. In fact, quite a lot of bugs are resistant to certain antibiotics, which you can make even more resistant by using the wrong ones. You've got to find out the drug to kill the bug. Okay. But you can't just leave it at that. You kind of got to look for why. Because cats shouldn't.
So what are the reasons why?
Sure.
Diet?
So CKD is probably the top cause. Because CKD causes a diluted urine. So remember the concentrated urine in the young cats, why we don't worry about bacteria. Diluted urine means all the natural defences are lowered. But what it also does is it makes them polyuric, which means they produce more urine. So instead of having the passage from the urethra, from the end of the bladder to the end of the cat, being dry, because we do a wee and then that's it, and then it fills up and then we do a wee and then that's it, this passage remains a little bit damp.
Yep.
So what that happens is that bacteria from the butt, which normally can't get in, have like a little kind of bridge of wetness to travel along.
Like a slide.
A slippery slide.
Slip and slide.
They also have less toxic environment because
it's not acidic.
Because it's dilute. It's just not got all that toxic stuff that's in urine. So they shoot on in very easy. Potentially add to that, senior cats are more prone to IBD, tummy troubles, so you have a bit of diarrhea, and that might even further exacerbate the chance that it can go in. So females with CKD...
But even them grooming, can that do it? Like, can they...
Well, potentially if they've had a bit of a yucky bum, like if they're obese or they're arthritic and they can't get around to groom properly and poo kind of stays around there for too long.
So it's basically poo that's going to cause
it. Yep. So females are far more susceptible because they have a shorter, wider passage. With the boys, as we talked about, when it comes to catheterising, it's a lot trickier, but not impossible for the bacteria to go up there. Other causes, diabetes. So diabetes in an older cat is more common. That means that, especially if it's not well managed, they're going to have sugar in their urine, and sugar is a beautiful environment for bacteria. They also tend to be polyuric, so the passage is wet as well. So that's a really good environment for them to kind of traverse up. Hypothyroidism and liver disease also tend to make them drink more, also tend to cause a more dilute urine. So again, you're just lowering those body's natural defences. So for a cat who I've never seen before who comes to me with a UTI that's
you're gonna
old,
ask why.
Exactly, you've got to run bloods.
So can stress cause a UTI as well?
Look,
no,
not directly. Not really, no. I mean, unless the body is under great duress. So,
So when we say stress will cause a UTI, what we mean is stress will cause the FIC.
Yes, correct. I mean, potentially prolonged stress on any individual could lower your immune system. So it could lower the barriers that we talked about.
But I
wouldn't
UTI
say
is
stress
bacteria.
equals UTI. UTI generally is due to something underlying. So Rollies UTIs tend to happen as a consequence of the fact he's got renal disease. He also has arthritis. So when he toilets and passes a lot of urine, sometimes it leaves a bit of a puddle that makes a bit of a mess on him. Which obviously keeps that passage wet and allows it to go in. So they tend to be his main sort of triggers. Okay. There are some more unusual...
Can it be just because they're fed a purely dry diet, or that's...
Yeah, probably less so with your UTIs. Yeah, I wouldn't have thought so, to be honest.
UTI is bacteria, and it's going to be some way that the bacteria's got in there.
Yep.
And it will always be up.
But you're still going to be recommending a high, even though,
always.
The dilute urine is, what's caused it.
Yeah, but
you still want to flush.
Make it acidic though.
No, you still want to be flushing the body through and flushing all of that sort of out of the body.
Yeah.
So, and I mean, obviously with renal disease, a big reason why they need a lot of fluid is because they're involuntarily losing it. So you're just replacing what they've lost. You're preventing them from being dehydrated.
But is that also to cause less stress to the kidneys?
Yeah, so what happens if you're dehydrated, then the kidneys are put under duress.
Stress.
Yeah, they're put under stress, exactly.
Yeah.
Yeah, which can further progress the disease, basically.
Yeah.
Yeah, so for the younger cats, I wouldn't do a blood test. Well, obviously, if you want to do a blood test, that's always very useful for just trending for levels within the individual. But it's not critical that a blood test is performed unless they're obstructed. Okay. For the oldies, I would suggest full blood test.
So I bring my old female cat to you, Priscilla.
No.
She has a UTI.
Yeah.
Ladies don't have UTIs. She's a lady. So you automatically want to do a blood test because you think there's something else behind it.
I want to know why, exactly. Stones are a bit more common in the oldies as well. So if you don't have a really obvious reason on your blood work, or if you've got a client that just wants to know, like, so for example...
So what's gonna cause a stone?
So stones is generally...
Stones is crystals, right?
Yeah, so sort of. Stones are either really conglomerated crystals or an excess of the precipitate that causes the stone, which I wouldn't say entirely are diet related, but commonly diet related. So struvite definitely, we do feel is relating to, your more alkalizing problems and a consequence of a lack of dilution. Your calcium oxalate, we're not entirely sure. We think maybe diet might play a role, and there are certain diets which perhaps are a bit too high in calcium. There are some thoughts that even some plants that cats might munch on might be a bit high in calcium.
Okay. So some cats that are eating diets that are bone heavy, so high in calcium, that can cause...
I wouldn't say direct link, but it would be, potentially would be a trigger.
I've said that before.
Need to be wary.
Yeah.
And calcium oxalate really tends to be the trend for the future. Like struvite is less common, calcium oxalate is becoming more common, which I think is interesting. I don't really know why.
Well, if that's due to too much calcium, then that's something's wrong in the diet.
Yeah.
Interesting.
Calcium oxalate's a tricky one because they can form throughout the body. And they can also form in the kidneys. So struvites don't tend to form in the kidneys.
Okay.
The calcium oxalate stones can form up higher in the kidneys, and the ureters of the cat are even smaller than the urethra of the cat. So you can imagine if a stone...
passing it from the kidney to the bladder then...
is a real problem. And obviously you can't catheterise that.
No.
So...
And you can't really...
It basically kills the kidney. So the way that those cats are treated is with a subs placement. I don't know if you've heard of those before. So the subs is a subcutaneous ureteral bypass system, subs. And so that basically is if a cat is caught within the first 24 to 48 hours of obstructing a ureter, which often sadly gets missed. If you leave it too long, the kidney won't recover. So if that gets diagnosed, they get referred off to Murdoch's, really the best place, although I think Waves is starting to put them in, and they place this system that basically has a little kind of bleb under the skin, and then it has a tube that goes into the bladder and then a tube that goes into the renal pelvis. So it bypasses the urine that way, so the ureter becomes defunct. And then there's a little port that you can obviously then flush to make sure it doesn't get any sort of debris.
Permanent or temporary?
Permanent. Most of the ones we've had that have gone for subs, not many people go to that extent.
It's a lot of money.
Most of them probably have a few year lifespan beyond that before they go into end stage renal failure.
And if you don't catch it, that's it.
Well, it depends on what the other kidney can do. We have had a couple that we've treated conservatively and hoped that the other kidney had some function. Obviously, there's no guarantee that the other kidney might not obstruct as well. So basically what happens is the kidney gets really big and then it shrivels really small, and then it's just a non-functional kidney and they're surviving on the other kidney.
All right, so you don't remove it or anything like that?
No.
And it can't just pass that stone?
Once it's wedged there, it's well and truly stuck. Yeah, there are some cats they think are actually little hardened bits of clotted blood as well. Some of them are not actually a stone, so they must have something that caused a bit of a bleed.
We don't know what causes that.
We don't see as many of them as they do on the east coast, interestingly. So I wonder whether we've actually got a lower incidence of even calcium ox over here.
I wonder if the water makes a difference.
Must do. So the ones that get treated conservatively basically have to be on IV fluids until we're happy their renal function continues. A lot of them will go into renal failure and it will be fatal. So
that's the calcium oxalate ones, and that's caused by too much calcium.
Or sometimes hereditary as well. So there's just a hereditary predisposition.
And is that as common as... So the most common is feline idiopathic cystitis.
Yep. We don't see stones very often.
And then UTI, but only in older cats.
Yep.
And then you've got a few other little...
Yep.
And we've come to the end of our first episode of Ask a Vet. Thank you all for listening. I hope you found the info helpful or at least interesting. I know I learned some things I didn't know. A big thank you to Dr Martine for her time and generosity in sharing her knowledge. Join us next time as we delve further into feline medicine. Ask a Vet is brought to you by Meow and Perth Cat Hospital.